Okay, perfect, everyone. Welcome to session 3 of TMF Maturity Day, session 3 of 4. For those of you that have been in the first 2 sessions, kudos to you guys for sticking with us as we complete and go through these sessions of TMF Maturity Day. Again, an event brought to you exclusively by Montreal. You'll see a familiar face in Donatella Ballerini, who's been with us since the beginning of today.
I hope you are not tired of me.
We could never be tired of you, never. But now we've also brought in Montreal CEO Paul Fenton, also resident TMF guru, and member of the TMF Reference Model Steering Committee. So super excited to have you here as well, Paul.
Thank you. I'm excited to be here too.
All right, so we've got people folding in. Would love to hear as people are jumping in where you're coming in from, where you're dialing in from in the world. For those of you that were on the last session, there were lots of questions on the TMF process session that we just did. So if you guys didn't get your question answered on that event, now is the time for you to repost that question and ask it, because this entire session is going to be focused on answering your questions. This is an ask me anything or ask us anything session, so we can put our TMF experts to the test to see if they really know what they're talking about. No pressure.
Now you scared me.
Yeah, that's it. Yeah, ask your most difficult questions, guys. Let's see if we can stump these guys. All right, I'm going to kick things off. We've still got a few people rolling in. Thank you again for joining us, but I'll kick things off again. Sessions are going to be 45 minutes. I predict that this session is going to go a little longer, just because we already have a lot of questions that we received from the community ahead of time, which we're going to be answering first. This session is recorded and will be made available afterwards. If you have questions, please head over to the question tab on the Zoom panel. The Q&A, it says Q&A, and there are 2 little sort of conversation or speech bubbles. If you can look there, that's where we want you to ask your questions. As a reminder, we've completed 2 sessions already today: how to identify your organization's maturity level and how to plan for growth, building a TMF management process from start to finish. And then, of course, we are now at the trial master file AMA, Ask the Experts Anything. I just wanted to highlight for those of you that are attending this session for the first time, TMF Maturity Day is really designed to help you guys understand the level of TMF maturity that you are at. However, practically being able to move towards improving that maturity comes through education, process evaluation, and a whole range of other things that, of course, we include as part of our TMF maturity training packages. It's a series of level-based courses. So we have essentials, intermediate, and advanced, carefully crafted, very comprehensive educational sessions designed specifically for your team. So you invite all of your TMF stakeholders, delivered exclusively to your organization, and paired with practical skill building workshops, templates, tools, and deliverables for you to make that education as actionable and as practical as possible. I went through this on the last presentation, but I'll just highlight very quickly. The 3 levels include a lot of different core topics. Of course, you can start at any level that you feel is most necessary, or even select certain courses and workshops that you think will be most impactful for you. If you're interested in receiving more information on that, please feel free to ask a question in the Q&A tab, and a member of our team will certainly send you some more information on the TMF maturity training. So that brings us to the core part of our presentation today. So I'm going to stop sharing my screen so that you guys can see the lovely faces of Paul and Donatella. What I'm going to do is I'm going to throw the first question at you guys. And so the first question is, it's a great question. Why are more and more sponsors looking to bring TMF management in-house? Paul, I'm going to throw that to you to start us off.
Sure. I mean, I've got my my thoughts on that one. Obviously, since COVID, things have changed a bit. Everything went remote. We went remote, and so also inspections went remote. And so it becomes really, really important for sponsors to be able to easily pass inspections. And so having your TMF in lots of different places with lots of different vendors actually makes it a little bit more complicated, unless of course you've got a very strong relationship with your vendor or vendors. And so I think that a lot of sponsors have started to think about, bringing the TMF in-house because it's just a lot easier to manage remote inspections. I think another reason why they're probably also thinking about bringing it in-house is because more and more of the artifacts are electronic nowadays. So even if a CRO is managing the TMF for them, at the end of the study, they're still going to have to import that study into their environment. They're going to have to hold it in a compliance system. And so why not just start right from the get-go with their own TMF system and then ask the CROs to work in that system. So I think that those are kind of the two sort of key drivers I would think are pushing sponsors to bring TMF in-house, but I'm sure Donatella's probably got an opinion as well.
Well, totally agree with you, Paul, in terms of, COVID has accelerated a little bit unnatural, in my opinion, transition from paper to TMF, from paper to eTMF, because definitely manage a paper TMF is really challenging if you have more than one vendor, but also internally it's really challenging and expensive. So definitely it was a natural evolution of the TMF story, I would say, and COVID has given an acceleration. By my personal point of view, if I were, let's say, the company to bring in-house, my first goal would be to increase the control of my TMF. And so I would like to have more oversight, more visibility, more control of my TMF. So definitely I would have chosen this option to have more control. And so to be able to ensure more inspection readiness, even if I know that obviously it will take resources, efforts, time. So it's a big effort in terms of internally demand, but definitely to improve my knowledge, my control, and my awareness of the status of my TMF, because it's so relevant, for my business. I would choose, to bring in-house everything, definitely.
Amazing. All right, so we've got a quick poll that we want to throw up because it leads into the next question that we have around risk-based approach. So I'm going to launch that poll. If for those of you can head over to the poll tab. So the question is, are you currently taking a risk-based approach to TMF today? So yes, somewhat, no, or don't know. Because the next question we're going to answer is how to implement a risk-based approach. So for those of you that may not already be taking a risk-based approach, we're going to dive into that in a little bit more detail. We'll give everybody a few seconds to respond. All right, interesting results so far. I'm going to give everybody 3 more seconds. So 3, 2, 1, and end the poll and share the results. Paul, what do you think of these poll results?
I actually thought that there would be a lot more people. Sorry, that there would be a lot more people answering somewhat. But it's great that 31% of you actually are using a risk-based approach, and 37% somewhat. So that's 68% of participants who are somewhat or using a risk-based approach. I think it's really important, and I think it's something that we're quite a lot of organizations are still struggling with to get it right. But I think it's super important that we do it. So, yeah.
All right. So that leads us into the next question, which is, how do I implement a risk-based approach that will be acceptable to an inspector? Donatella, I'm going to throw that question at you to start things off.
Yeah, sure. And thank you, because it's one of my favorite topics, risk-based approach. And the answer to this question, honestly, would take lots of hours. So I don't think that we have enough time to go through each step of the implementation of a risk-based approach, because it's really a big process, lots of steps and aspects to be taken into consideration. So we even create a training and a workshop for that, because definitely it's a massive and robust topic to be discussed, and it's a requirement. So it has to be, understand and analyze deeply. But what I can say is definitely that, first of all, the first step is to understand that risk-based is a requirement, and so you have to implement it. You have to take action to try to implement it, because it's not easy. Definitely it's not easy. It's a big challenge for big or small or medium organization. Secondly, you have to identify the biggest risk of your TMF, taking into consideration, in my opinion, that at the end of the day, we try to ensure the compliance with requirement for the data integrity and for the patient for the safety of the patient. So what we try to aim with a good TMF, obviously to be inspection ready, but that means that we have conduct our clinical trial according to requirement. And that means for us that the data are reliable and the patient safety and his rights have been protected. So based on that, you can identify the artifact, the process, the document owner even, that have major impact on these two areas of risk of your TMF. So I think that the most important thing, as I said before, to implement it, it's a long process. We don't have, let's say, enough time to explain each step of the process, but it's important to know that it's a requirement. So somehow you have to implement it. Define the process to do that. There's always, let's say, space for improvement. So maybe you will start with something easy and small in terms of TMF management, and then taking more experience, you can increase your process and make it more complete from a risk-based point of view. Even the software can help you to understand, by metrics and reports, which are the areas that you have to focus because are major high risk. So there are a lot of things to be considered, but always keep in mind that what we are doing to ensure the inspection readiness of our trial master file is the data integrity and the safety of the patient. I don't know, Paul, if you agree.
I totally agree. The only other thing I would say is it's super important to actually document the methodology that you're going to use and then follow it. Because the inspector, when the inspector comes, they're going to want to look at, what are you looking at, but also what's the methodology that you've been following, and are you doing it systematically? And even if it's not 100% perfect, as you said, Donatella, it's important that you have something that's written down, so yeah.
We have a really great follow-up question in the chat from someone who wants to dive a little bit deeper into risk-based approach and focus on how how reference checks and logical checks can be done after we implement a risk-based approach. Who wants to take that?
If I can. So
Sure.
Definitely once you have implemented, let's say that you have identified and developed a basic risk-based approach. So that, as Paul said, will be the methodology to apply to your TMF oversight and quality control. Because I think that we all agree that in a perfect world, we would like to review 100% of document every time that we do the quality check on our TMF. But it's obvious. It's a big book, a big story, your TMF, so you can't and you don't have enough time to do this check, this detailed check. So you need to apply this concept of proportionality, let's say, based on the risk-based process. So this is why it's important. This is why it's a requirement. I'm not asking you to check 100%, but check based on the risk. So if that area, if that artifact is higher risk, check it more than, a zone that you have already checked 3 months ago and so on. So as Paul said, you have to define a process, a methodology, and once defined, you have to apply it to your TMF. So on a regular basis, you have, once identified, check more frequently the zone that you have identified as high risk, that you have understood that can have a big impact in terms of data integrity and patient safety. So based on the parameter, you can definitely analyze and assess each artifact, each process, and each zone of your TMF for doing this kind of risk assessment and risk control, because in that way, when you will perform the quality check, you will have the rationale for why I have checked section 5, why I have checked this site and not that site. Let's think, for example, that you've got a trial with 100 sites. So it's obvious that you can't check 100 sites every time that you are performing a quality check. Where can I focus my attention? Well, by my experience, this is what I was used to do, was to focus my attention on the site that was enrolled most, that had more protocol deviation. Because, if it's a site enrolled very slowly, has no protocol deviation, maybe nothing is happening. So, but if a site is enrolling a lot with high frequency and there's a lot of protocol deviation, that has to give me an alert on my TMF, on my story. And so I will focus my attention on that site. If then I see, for example, that the site after some months will be in compliance with the protocol, no deviation, and the enrollment is okay, I can focus my attention to another aspect. So based on the methodology, on the risk assessment that you did, then you can define the strategy for your quality check. And this is what the inspector want to see. They want to understand how you define your methodology, and they want to see the evidence that you implement and did that methodology on your TMF check.
Yeah.
Would you agree?
Absolutely. Couldn't have said it better.
There's a really, really good follow-up question that I want to throw to you, Paul, because I know that you've talked about this before, from Barbara, which is, are there any developed risk scores per artifact or sub-artifact that could be used as a basis for a risk-based approach?
Yeah, so it's a super interesting question. It's something that we've been thinking a lot about. There was an exercise that was undertook, I think it was a couple of years ago, that was published, and there was 5 or 6 different individuals from primarily big pharma companies that sat down and actually came up with a scoring for each of the different artifacts based on the reference model, which I think is a really good first start. And it's something that we're looking at actively and within our organization as we start to think about how can we get systems to really drive risk assessment and risk scoring. But I think it's a good start. I don't think it's the ultimate methodology, because I think there's lots of other factors, like what Donatella mentioned, things like recruitment or protocol deviations or queries. There's a whole bunch of different things that could actually have an impact on risk, not just the type of document. But I do think it's a really good start. And I think we can probably publish the link to that article. We can dig it out and publish it and send it out to everybody, because I think it's worthwhile having a look.
Perfect. We're going to dive into now some questions around the TMF reference model. Always lots of really great questions about the reference model. So the first question is, do you have any tips for trying to implement the TMF reference model in a new TMF? Donatella, I'm going to throw that question at you. Any tips for trying to implement the TMF reference model in a new TMF?
Well, first of all, you need to understand the TMF reference model, because, not everyone, even if it's so largely used, but not everyone is working with TMF reference model. So not everyone knows in detail, the column and the requirement of the TMF reference model. So first of all, train your people, train your team on what is the TMF reference model, because why it is important to have it, why it can be helpful to have it, because it's a roadmap, because it guides you in knowing where the artifacts are located. So it gives you really a map of your TMF, of the document of your TMF. So first of all, understand why this tool is useful. And secondly, there are some columns in the TMF reference models that are helpful to customize the TMF reference model to your organization. So the TMF reference model gives you a guidance in terms of what are the section, what are the zone, what are the artifact, and plus the sub-artifact that are contained in each zone of the TMF. But you have to consider also, as discussed in our presentation, your internal SOP, So based on your process, define what are the documents that are an outcome of your process, and that have to be kept and captured in the TMF reference model. Any data naming convention that you have to apply to your documentation to ensure the consistency is another aspect that you should take into consideration when you try to implement the TMF reference model in your TMF, because that will really help you to ensure and guarantee more quality of your TMF management. So there are, let's say, some some columns that can be customized. And I think that what you have to do is really to work with your team to customize and understand the data that have to be put in those columns. Another example, document owner. It's really important when you've got a TMF reference model, who is the document owner of the artifact, because in that way, for example, you can ask in case of an issue with a document that is missing to the document owner, to fill that gap, to collect that document. So you know who is accountable and responsible for that particular artifact. So definitely there are lots of information that are not standard information, but are related to your specific company, specific situation that have to be implemented when you want to develop your TMF reference model for your TMF. So do that exercise, because definitely it will help you, first of all, to ensure the consistency of your TMF, and secondly, to have a proper and better management of your TMF. Do you agree, Paul?
Absolutely. Yeah. I also think it's important to, if you start making a lot of changes, don't change the artifacts. Don't change the artifact numbers, any of that stuff. Use sub-artifacts. So sub-artifacts are quite flexible. There's a bunch that are suggested, but you can actually have your own sub-artifacts as well. But I always suggest that if there's something that's very specific to you and you don't call things exactly like they're defined in the reference model, well, create a sub-artifact and use the sub-artifact instead.
Amazing. We have a follow-up question, which is again related to the reference model, and it's how do I adapt my current TMF plan or my index or my system configuration to reflect updates to a new version of the reference model, or do I even need to? Is it important for me to do that when a new version of the reference model is released?
So I would say the first thing you want to do is obviously do an impact assessment of the changes. In some updates, there are very few changes, but other updates can have fairly significant changes. So for example, when we released 3.2, there was a lot of changes because we introduced the concept of sub-artifacts. And so there was like 600 odd sub-artifacts that were added. So you need to do an impact assessment. Okay, well, the changes that are being introduced, will it make my TMF better if I implement them straight away, or should I wait? The other thing that you should also do is speak to your vendor, because quite often your eTMF vendor is the one that's actually going to have to implement the changes within their system so that it becomes available to you. So it's also important to speak with the vendor and just find out, okay, well, what are your plans for implementing this new version? And then the other thing that's important to do as well is to attend the general meetings for the TMF reference model, because you'll get advance notice about changes before they're actually released. It's a very kind of open, collaborative environment. And we definitely talk about changes before we actually make things final. And so it's good to be aware of what's coming up in the future. Okay.
We have a follow-up question that kind of dives into, you mentioned vendors there and working with your vendors to make sure that there's alignment. A question from the audience is, and it might be a little bit of a controversial question, which is, would you hold your vendors accountable for their documentation in the TMF? So for example, if you outsource medical monitoring or site monitoring, can those vendors be required to upload and manage their documentation in the TMF, similarly to other, functional teams or stakeholders internally? Paul, what do you think?
Totally. You just need to make sure it's clear that that's your expectation. So you should have, either a contract quality agreement, some document that clearly states you are responsible for doing this, and it may even fall under transfer of responsibilities. Something to think about. But definitely, yes, they should, and obviously you need to make sure they have access to be able to do so, and then make sure that it's documented in some form of binding agreement.
Donatella, anything to add there on your end?
Yes, I would like to add to the words of Paul that definitely it's very important to define the expectation in terms of TMF requirement. So if you have more than one vendor or other actors in the TMF process, definitely there must be an alignment and clear expectation of, I expect the TMF to be always everyday inspection ready. And this must be defined and detailed, if not in the agreement, I would suggest, as said before, in the TMF plan. So it's very important. Detail. Majority you can detail, it's better, because in terms of responsibility, accountability, expectation, if it is not well defined in the agreement, which obviously will be in place, defined in another document which will be signed and agreed, like the TMF plan. And the other last is that for the sponsor, you can outsource almost everything, and in some cases it makes sense, for example, outsource to the vendor, to a CRO. But remember that for ICA GCP, at the end, the responsibility is the sponsor. So this is why it's really important to set up, to agree on the expectation, and to verify that those expectations are met during all the life cycle of the clinical trial. Because at the end, when the inspector will knock to your door, is the sponsor the responsible one for the inspection readiness of the TMF, even if he has outsourced everything or some of the activities.
Agreed.
All right. Next question. I'm going to throw it to you, Paul, first, which is, how can I engage other non-TMF stakeholders in the TMF management process? We've talked about that quite extensively this morning, but now that we have you on the line, I'd love to hear from your perspective. Like, what would you suggest teams do to engage non-TMF stakeholders?
So several things. I think, first of all, we should be using the TMF in a very proactive manner. So making the TMF actually very useful for the team. So helping them collaborate on document creation or document review and approval, providing them with really good reports and metrics and analytics that actually give them something back for collaborating within the system. So I think you have to make the system interesting for those different functional groups, so that they want to go in there and actually work in there and collaborate. And that way we have a better chance of well, not enforcing, but encouraging people to follow the processes, right? If they're in the system. I think the other thing that's super important is to actually train people on the importance of timeliness and the TMF and what the TMF means for the organization, and ultimately the fact that it's going to be used to be able to defend a new marketing application for their drug. So it's super important that everybody really understands how key and important the TMF is, because I think that probably a lot of people don't always truly understand the importance, and they just feel that it's a repository that we have to put stuff in at the end of the study. So it's really important to train people and sort of make them aware of the importance.
All right, perfect. Thank you, Paul. I have another question from the audience from Audria, which is, in the spirit of completeness, how do you define relevant communications and ensure that emails and other communications are accurately captured in your TMF, being that they may come from different sources? Donatella, I'm going to throw this question at you because I know you have an opinion here.
Yeah, no, I mean, emails is always a very hot topic, I would say, in terms of TMF management. Because it's very tricky, because first of all, lots of people don't think that email are relevant, but if you think to the goal of TMF, to tell the story of the trial, emails are part of the story of the trial, because majority of the time, unfortunately, lots of the decision during the clinical trial are kept in an email. So we are lucky if the majority of the process are the outcome, as an outcome a document, monitoring report, CSR, protocol deviation, and so on and so on. But sometimes big decision, important and crucial decision for the clinical trial are made and taken by emails, because we know how we work today. We work by, emails, chatting, and all the stuff. So emails, not all the emails like good morning, good afternoon, happy birthday, and have a nice Christmas, but some emails are really crucial to tell the story. And if you don't keep that email in your trial master file, your TMF will lack in a piece of the story. So obviously, first of all, you need to understand this one, so that email can be relevant for your TMF. Develop the process. There can be different approach. There's no a standard approach. There's no a requirement in terms of expectation. There's the requirement that you have to fill. Obviously, if it's relevant, the document is a TMF, but there are no specific, I would say, guidance or requirement for doing that. What we suggest, especially in our training, and for example, in our template of the eTMF plan, is, these are the options to manage the emails. Different options based on different needs, on different organization. Choose the process that fits you better, and then follow it. It can be, for example, don't fill the emails in the eTMF, but keep an Outlook servers with structures with the TMF reference model, and fill the emails in that Outlook repository. So there are different options that you can choose. The most important thing is to define the process and to ensure between all the stakeholders the consistency of that process. Because if you, let's say, train or make aware of this process, that's the clinical team, you will miss, for example, the CRO emails or the pharmacovigilance emails that are very relevant, because basically they manage the serious adverse event and all the stuff. So you need to be aligned on the expectation of the process for emails management and relevant communication management in your TMF. So this is why we suggest, because it can be challenging to write just an SOP or a working instruction for emails. So let's put a paragraph, a chapter, let's say, in the eTMF plan, define the process in that document, and everyone who is expected to be responsible for TMF need to be aligned on that process. Or do you have any suggestion to add?
No, I don't. I think you nailed it, Donatella. It's all about defining the process and ensuring consistency. Not an easy topic, though.
No, definitely. It's very challenging. Very challenging. I mean, I think that we still have to find the best solution, but we have to try to start somehow. So, yeah. Definitely.
I mean, I think another area which is kind of interesting is instant messaging. So nowadays we're using Teams and things like that more and more, right, across groups, and it's kind of similar. Like we're starting to make decisions in those environments. So we need to kind of think about how do we handle that. And
I think about even the meeting minutes. I mean, I see that majority of the time you don't take the meeting minute, even if they are relevant, but because, now you can record the meeting, and so you have maybe some slides. Right. But it's difficult if you think, maybe in 6 months, I will have to reconstruct what happened during that meeting, and I've got just some slides, but okay, but what was the discussion? What was the feedback?
Exactly. So you need to have a policy on that. I think you need to sort of say, okay, well, if we're going to have an online meeting, well, this is how it needs to be documented, and this is what needs to be filed.
Because again, it's always the story. If it's not documented, it didn't happen.
Yeah, exactly.
And that is the truth. I mean, how can inspectors say, "Oh yes, I understand that you did that you said that," if you don't have the evidence? You are the one that spoke. You are the one that conduct the call. You can perfectly tell the story, but if you don't have the evidence.
No, exactly.
It will be a finding.
Yeah.
All right. We have a couple of, I think, more tactical questions that are really well aligned with this concept of filing in the TMF. What do we file? What don't we file? So the first question from Aubrey is, what are the best practices for specifically filing safety reports in the TMF? Is it best to keep them in the safety database, or should we be moving them into the TMF? Who wants to take this question?
I can start just by saying whatever you do, because I think either is appropriate and possible. It's just super important to have one version of the truth. So don't have copies. But I'm pretty sure that Donatella also has an opinion on this one.
Yes, I mean, as you said, there's no regulatory requirement in having just one source of truth. Obviously, it is better and much easier to have just everything in one place. But in case, for any reason, you manage those particular document in another system, which has to be validated, this is a must to remember. Just don't copy and paste those documents in TMF. Just be aware and write somewhere, for example, in the TMF index or in the TMF plan, that that particular zone section of TMF is kept in another system, and be always, available and know how to manage the access, because if the inspector wants to see that system, he must have access to the system as well. So,
right.
And second, I would say that it's a process. I mean, my experience is a process. When we starting to engage and involve the pharmacovigilance, the first reaction was, we've got our system, we are not going to use ETMF because we've got everything in place in our system. Yeah. So in case of inspection, they will find everything there with the structure, blah, blah. After training, workshop, communication, try to make them understand it's better if everything is in the TMF. We were able to move pharmacovigilance to eTMF. They identify a super user, let's say, of the eTMF, and so the documentation were finally managed in the eTMF. So it's not mandatory to have everything in one place. Maybe it's a process to engage and to change the mindset of people, saying, well, at the end of the day, everything has to be there to tell a good story. So maybe it's better to use it, this system as the unique one. But yes, maybe it's not, from today to tomorrow, let's do this change. It's step-by-step process, it's a change in mentality. But yes, definitely, whenever decision you will take, documented and agree, obviously, with the pharmacovigilance.
Yeah.
All right. Another quick question. So Nikita asks, is a TMF plan and a vendor management plan the same? Now, we explained the TMF plan earlier, so maybe you could explain a vendor management plan and maybe how that's different from a TMF plan.
Well, it would be easier to show you. Definitely. I mean, if I could show you our templates, I think that you can easily understand that vendor management plan, I mean, by my experience, was really a very executive summary of, of some agreements and detail between the sponsor and the CRO. Or other vendor, but it was not the detailed document that I'm talking about. Just to give you an idea, very high level, we are talking about a document without adding details and exception of 20-25 pages, where you really, call to a table all the actors of the TMF. So the sponsor, but from the sponsor side, you have to consider clinical operation, pharmacovigilance, data manager, statistician. So you have to consider all the function inside the sponsor. And then you call, in case, the vendor, maybe the central laboratory, and maybe you call the CRO, because there is even the CRO that managing the TMF. So you call all the actors to a table and you say, these are the expectations, these are the responsibility, and these are the activities. Who is doing what? And then you all agree on the activities, and you all agree even on the rules of the TMF. For example, as we did the example of the emails. I don't want that me as a sponsor manage emails differently from the CRO or for the vendor. We all need to have one rule, and we need all to have this rule to be followed to ensure the consistency of your TMF. Otherwise, we will fail. So it's really a way where you thanks to whom you can ensure more quality and inspection readiness of your TMF, because all the actors will agree on the expectation and on the details of the agreement. The vendor management plan is more, an appendix, I would say, of the contract on how to manage the vendor, but it's not the details that we are referring the TMF plan. It's more from operational point of view, it's really more helpful than a vendor management plan that is more, let's say, high level, I would say. Paul, what do you think?
No, I totally agree with you. I don't have anything else to add. I think you explained it perfectly. Yeah.
All right, we got some technology related questions here. So Paul, you're in the hot seat now. And we're going to talk a little bit about AI and machine learning. Obviously, everybody in the TMF world has probably heard someone mention artificial intelligence and machine learning and how, the benefits that it could bring. But the question here is, how will AI and machine learning impact TMF in the future? And am I out of a job? Being the TMF focused individuals.
So the good news is you're not going to be out of a job. Your job's actually going to get a lot better. I think that there's actually a lot of potential for AI and machine learning in the TMF world, because AI is actually pretty good at things like identifying documents or extracting data from documents, or even doing a certain amount of visual QC on documents based on patterns. This is really what AI and ML is good at, but it's only as good as its masters, and so it's important that we still have experts who are involved in helping to train that artificial intelligence to really validate exactly what that artificial intelligence is coming up with. So I think that definitely we'll start to see more and more AI in our daily lives within TMF, and it's going to be great because it's going to be doing a lot of the heavy lifting, a lot of the very manual work that we typically have to do today. And it's going to allow the CTAs and the clinical teams and the people that are responsible for overseeing and managing the TMF to actually spend a lot more time focusing on higher quality, higher value activities. So spending more time on sort of risk assessment and oversight, health checks, and sort of really focusing a lot on inspection readiness, and then letting the AI and ML do its job of really doing all of the heavy lifting with indexing and all of those kinds of things. I also think that it will change the nature of TMF. TMF traditionally has been seen as a document management system, or eTMF rather. TMF is a collection of documents traditionally that's sort of archived, and it's a group of archivists that manage it. I think in the future, TMF will also all be about data. So it'll be very data driven, because the AI will allow us to extract all of the data from the documents, or even stop using documents altogether. And so in the future, we're going to be doing a lot more with data, and we're going to be able to automate a lot of the different sort of cross checks and verifications that we do today in TMF. And so I think it's going to bring us a lot of value as well. And it's really going to change the nature of the system. And we're going to move away from a repository and move towards more of a process management system, an analytical system that really allows you to very easily understand what's going on in your study, but also more importantly, use the gold mine of information that we have in the TMF to actually actively manage your study. So it's really going to change things in a big way. And I'm very excited for the future. I think that there's a lot of really good things that are going to be happening, and AI is going to help us get there.
Amazing. So just to kind of move on, and I'm going to throw this question to you, Donatella, because I think it builds off of the safety reporting question that we had earlier. And this is, how should we manage quality events or quality issues which are managed in the CRO's EQMS system? Should they be filing them in the sponsor TMF, or there should be another approach?
The answer, Oliver, is almost not the same, but these are expectation and requirements and rules that you have to define with your CRO during the setup of the TMF process and management. Because there's no a best practice or there's no a specific regulatory requirement in these terms, but you have to consider that those documents have to be available and accessible for a long period. So what is the best option that you have? To keep everything and transfer everything in your system, or to leave SRO? So depending, I think, from the risk and from the impact of the document, you have to do some consideration. I give you an example. The CV of the study team, we usually, when we were working with a CRO, we were usually not collecting those CV because they were, let's say, available to the HR department of the CRO whenever it was needed. So we put just a note in the TMF index that those documents were not collected but available in case of inspection by the HR department of the CRO. I don't think that they can have a big impact in terms of data integrity and patient safety, the CV of a study team, so they can be, let's say, left to a HR department. Just be aware that they are available and obviously document the fact that you agree with the CRO that this document will be available in case of inspection. When we're talking about quality, it has an impact, a big impact on these two topics of data integrity and patient safety. So I will do my assessment and I will say, okay, what are the risk and the benefit to keep it in the TMF or to leave this document available for 25 years by the CRO. So you must assess and you must verify what is the impact, what are the consequences, the benefit and the risk of these both options. And once you have identified, let's say, your solution, your strategy that you want to follow, agree in the TMF plan, in the contract, in the agreement, how to proceed. Because again, the most important thing is that when there will be the inspection, you know where to knock the door, who to call in case the document is asking for, and where to find it. At the CRO, at the TMF. So this is, let's say, the best approach, in my opinion.
All right. Slight follow-up question that relates to sort of what do you file in the TMF and how do you deal with maybe sort of the records that may be managed by other teams. So there's a question here from Tina who asks, could you let me know your thoughts around documenting study team training? Does everyone actually need to sign a form? How do we go about managing study team training and the TMF?
May I take this question, Paul? And then
absolutely.
No, I mean, training is one of the most important things in terms of even ICA-GCP requirement, because if you are managing clinical trial, you have to be trained on the process, on the system that you are using, for example, TMF. You need to give the evidence that you are able to manage that part of the clinical trial, that responsibility. So the training certificate is mandatory, is a core document, because otherwise, how can you show the evidence, for example, that you are using the TMF, but obviously you did a training before? How can you show the evidence to an inspector that you are following properly a process, for example, the protocol deviation, if you haven't been trained, or if you haven't the evidence that you have been trained on the protocol deviation process inside your company? So to have the evidence by a certificate, by a training log, whatever you can call it, depends on your training process, internal training process, is really essential and crucial, because it's what the inspector will check. This person belongs to a study team. Okay, this person is to be trained on the protocol, on the monitoring visit, on the eTMF, on the CTMS. So I want to see the evidence that this person was trained. If I don't see the evidence, it's a finding.
Agreed.
Sorry, there I was a bit on mute. So we're running a little bit behind on time, so we're going to have time for about 2 more questions. So the next question I want to throw out to the team is, what do you think is the single most pressing challenge facing TMF focused teams as we move into 2023? What's the biggest challenge that you think teams are going to face next year? Paul, do you want to take a stab first?
Sure. I mean, I think that there are many challenges, but I do feel that one of the biggest challenges is the fact that inspectors are getting a lot more savvy about TMF and are looking at a lot more detail, and they expect to see you having effective processes in place, so that you can demonstrate that you've got effective oversight of the TMF as a sponsor. And so I think that that's that's definitely what a lot of companies struggle with today is oversight and demonstrating oversight and actually performing oversight. You know, how should I do it? Because especially some of the smaller organizations don't have that much experience, and so sometimes they need a helping hand to make sure that they have effective processes in place and that they have the bandwidth to perform adequate oversight that's going to be acceptable to the inspector.
All right, Donatella, what do you see as teams facing in terms of their biggest challenge next year?
Well, one of the biggest challenges that I'm still struggling in my mind, honestly, is the new requirement of the 25 years for the long retention of the document, because honestly, I think it's something easy to read, easy to understand, but how to do that for 25 years if I think that, technology changes so frequently. So definitely, I think that is something that if you don't start to sit down and think about how can I, comply with this requirement, honestly, I don't know, because it's really challenging in terms of technology, in terms of process. So it's something that team needs to start to dealing with and to start to find an approach, definitely, because now the requirement is there, so it's part of our responsibility. And the other, let's say, challenge is a challenge that I still see, despite all the training, despite all these webinar, I still see the challenge of making understand people that TMF is not a repository, but it can be really a very active tool that can improve your clinical trial process, because it's a source, as Paul said, of lots of data, lots of information that once you realize that this is a source of information, you can do lots of things and action and strategy based on what is contained in TMF. So it's not just a repository or a collection of documents, it's more than that. And the more I'm working with TMF and company, the more I see that this mindset is still there. So even if next year we will be in 2023, I think that there will be still people that think, okay, it's just a repository, let's fill the document and that's all. No, there's a lot of things to do that you can do. So
Yeah.
All right, last question before we break for the day, and this one is going to you, Paul, which is, and I'm going to ask you to get your crystal ball out and let us know what sort of predictions do you have for how the TMF environment or the industry will evolve, more sort of short to midterm over the next sort of 1 to 5 years. What are your predictions?
So there's so much I could say on this, but number one, I think, as I said earlier, we're going towards a much more data-driven TMF, and a much more sort of active study management system rather than a repository. Absolutely. I think as we start to see more and more AI being used and our ability to extract and identify data that's contained within documents, we're going to start to see more sort of creative uses of that information to tell a better story through the things like storyboards and sort of visual process-based visuals of instances of processes that have happened within a clinical trial just based on the evidence that we've collected within the TMF. I also think that eventually we'll start to see that CTMS and TMF also kind of start to merge together as more and more data becomes available in the TMF. Because if you think about a CTMS today, it's a tracking tool. We track activities that are occurring in the study. If data is being entered into the TMF in a timely manner, as it has to be, there's no reason why we should then take that data out of the TMF and transfer it into a CTMS. Why not just use it there and then, and have those trackers available and being generated by the evidence that's being collected within TMF. So I think that the future is definitely very interesting. It's very data driven. It's very process based, and the TMF will become trial master file. It still is a trial master file, but it will also become a very much a trial management tool as well.
Okay, perfect. Well, that brings us to a close today. Lots of really great questions. If any of you didn't get any of your questions answered, feel free to reach out to us directly. You can reach out to Paul or Donatello or myself on LinkedIn. We'd be happy to see if we can help in any way that we can. We are starting our next session in about 5 minutes time. So quick break for everybody before we jump into the next session. I want to thank you for being such an engaged audience. Obviously, Paul and Donatello, we've put you through your paces today, but I think you did incredibly well answering some really, really great questions. And with that, I'll end the session for today, and we'll see you on the next and last session of TMF Maturity Day.
Great, thank you. Thanks for asking us to speak. Bye-bye.
Bye.
Bye.